Honorary Minister, everybody. My name is Kasabov. I am the science leader of the Singapore MB project, and with me is Dr. Mariam Doborje, who is the principal investigator. Now, this project was designed mainly in collaboration with the Singapore team, and we have representatives from Nanyang University of Technology, Institute for Mental Health in Singapore, and National University in Singapore. Our team is constructed by experienced researchers and also young researchers. We have Professor Edmund Lai here. We have Dr. Zora Doborje here. And of course, it's us, Mariam and I. And we have a very strong Maori representation in this project. Margaret Williams is leading the Vision Mataranga. And we, of course, have young researchers, very talented. Can you stand up, please? Samuel Sugam Balkaran. Yes, here they are. Thank you. And we have a new PhD student from Maori community, Teina. We also have consultants, research consultants from University of Nottingham Trent University, and we have Dr. Ngaporo, Dr. Alex Merkin on psychology and psychiatry. Now, what is the problem of this research? So the problem is that the research is about new data science for improved mental health. What is our proposal? Solution. Our solution is that we develop new methods for personalized prognosis and diagnosis of mental illness using multimodal data and novel computational models. Now, we emphasize on three aspects: personalization of the modeling for profiling, multimodality of the data, and explainability of the models. And if we talk about mental health, this is one of the health problems in New Zealand, and I have actually copied part of the article in New Zealand Herald, November 23rd. And the article said that new data shows 73% of Kiwis 18 to 34 age struggling to cope. And this is also very interesting that one part of the article says, and 40% of 18 to 34-year-olds had seriously considered suicide or self-hurting in the past year. That is a very, very worrying situation in New Zealand, and we are very glad that the Ministry of MB and Singapore have decided to fund this project. And data science can do a lot, and we hope that there will be more funding from the ministry in the future, because this project finishes next year, and we want to continue with other projects with MB, please. Of course, what can be done in data science is to take data and try to predict events early rather than wait for the events to happen. And we have developing leveraging crowd capability, always with Vision Mataranga. We have additional development, and we have excellence in terms of papers submitted and methods presented. We have objectives that will follow our plans as we have planned that. And I should say that we have developing a work package that uses multimodal data, genomic, clinical, cognitive, neuroimaging, and we are developing computational neurogenetic models to deal with this data and to early predict events. All KPIs, we are happy to report that they have been addressed, and the program also has some future development planned to develop further publications and further research. Vision Mataranga, of course, I will ask Mariam to say a few words.
Thank you very much. Kia ora, everyone. My pleasure to be here today, and I would like to just give you a brief overview on Vision Mataranga. So as you can see in this slide, most of the KPIs related so far they have been completed. We have been in touch with Maori community stakeholders and advisors since beginning of the project. This is quite important to have early engagement and development of the roadmap, that how we can bring Maori knowledge inside the developments. While we are starting and developing our AI algorithms, we have to consider fauna-driven information, especially when we deal with mental health. So just to let you know that, so our vision Mataranga is driven with Hiningara is a gift from Io. And from the traditional Maori perspective, the concept of Hiningara is described as being your mind, heart, consciousness, thoughts, and feelings. And that's why, as you can see, we have been running 2 whole day Wananga for Hiningara-related information and bring them in the concept of AI development, as well as having some AI sessions to exchange knowledge between data science and Maori. The term is when we are developing a product that can be applied for mental health, we have to include Vision Mataranga concept and fauna-driven information since beginning, not at the end. This is something that we need to consider. It was just quite a brief overview, and I will come back again in the afternoon to provide more details.
So there will be, of course, a more detailed explanation of this project in the afternoon. So stay here.